most famous physical therapist on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to go over the number one cause of painful knots in the upper back, traps, and shoulders. And we're going to show you how to stop it. Plus we're going to do a giveaway.
Well, say no more, Bob.
If you are new to our channel, please take a second to subscribe to us. We provide videos on stay healthy, fit, pain-free, and we upload every day. Also, join us on our website, bobandbrad.com. Go to the giveaway section and sign up for our weekly giveaway. We're always giving something away. Sometimes it's small, sometimes it's huge, like a mattress.
That's right.
Go to Bob and Brad on Facebook. It'll always be pinned at the top of the page, the contest that is.
Right up there.
And you can also go to Twitter or Instagram or TikTok. We have a 60-second version of our program. What we're giving away today, we'll talk about it later.
Oh, okay.
It's part of what we're going to show. That's the giveaway is what we're going to show here today.
How to use it, yes.
Yeah. So quite often, the number one, when you have painful knots in like we call trigger points, myofascial trigger points.
Sure.
Up in these areas here quite often, very common to have it up in the upper traps, between the shoulder blades, kind of the upper back here. That's usually what we call referred pain. That means the pain is not coming from the muscles themselves. They're actually referring, and what they're thinking, believe one of the theories is it's referring from your spine.
Mm-hmm.
And actually the little lining on the outside of the spinal cord, they
Sure.
think may be causing it. So what causes it, causes the spine to send pain off like that is poor posture, especially a rounded posture right in here from what we call T7 to C7. I'll show you this on the spine here.
Sure.
So we have 7 vertebrae that make up your neck. So count them off: 1, 2, 3, 4, 5, 6, 7. Here's C7.
It's usually one of that larger,
Yeah,
prominent
the
bump.
bump.
Yeah,
Yep.
the bump.
And then you also have 12 thoracic vertebrae. But if you take it down to about T7, going down to about T7, it's right below the shoulder blades is where T7
Right, that's
is.
kind of your landmark, the shoulder
So from
blades.
here to here, this is the problem area. And when I see people with bad posture, it's almost always that area is like this.
Sure.
Almost consistently.
Yeah, they're doing this posture like this, like at their cell phone, at a computer, that the gravity's taking over.
Shoulders might be rounded out too,
Yeah.
but no matter what, this is the problem here. The issue is that if you had your back like this for a number of years,
Mm-hmm.
they've tightened down.
Yeah.
And it's really difficult to straighten it up again. You're the person we tell straighten up, and you go like this,
Yeah.
because you can't even straighten that area up. This is where a product like this comes in hand. Now you can use a tennis ball too, but
Right.
it doesn't have the specificity of the Pro-Point here.
Right. This is made to get right to that facet joint or that muscle knot that you want to.
And can get right into that and stretch it well. Some of you may be not able to tolerate this to start off with.
Sure.
And that's why they do have suction cups on them. And if you have a smooth surface like a smooth door, it would take a very smooth wall.
If you got glossy paint, I think it might, but like on glass or like a smooth that has a good finish.
Yeah.
A door or something.
I wouldn't do it on a glass.
Oh yeah, we don't want to lean up against the glass.
Right.
Yeah.
But the idea is that you can lean against it without putting your full weight on it. And then if need be, once you can tolerate it, you can go ahead and lay on the floor. And what you're going to do, Brad, if you want to turn around again. So you take one of these and you can go ahead and hit these areas here. What we like to do is you can take the suction cup off. So he would lay on the floor on this. He'd hit this spot, this spot, this spot. There's 6 spots he'd hit. So he's kind of going right down from the neck between the shoulder blades and hitting all the spots here. So these are nice in that you can work one side at a time. You don't need 2 of them. You can get by with 1.
Right. Yeah.
And they're fairly inexpensive and they're very portable. I guess one other possible use of them, Brad, you could go ahead and put your feet on them, right?
Oh yeah, for your
plantar fasciitis.
Sure.
You can use it on your hip and your knee and stuff like
Should
that.
we demonstrate
why
a
don't
little?
you show? Can you show first, Brad, the where where we've been talking about
Yep.
C7 to T7.
Yep. So again, the suction cup comes off very easily. Set it down on the floor. A carpeted floor would probably work out best versus a hard floor. I got a yoga mat here, and you can see that. Now I'm going to work my left side, so my right shoulder is going to maintain. If you have never done this before, you want to be, start
it's very
cautiously.
aggressive.
Yep. And you'll notice now I'm going to move. I'm going to put pressure, and after you work with it, you'll know where your knot is because it'll be a little more painful. But it should be that pain where it feels and hurts so good, and after you work it for 20 to 30 seconds, that pain from the pressure should start to dissipate and relieve. And if that's the case, you're doing the right thing. And you're going to work it for, up to a minute or two. And you may want to go there. And I'm going to go, like Bob said, down. And actually, I can feel it right there. Yep. I got a Tootsie Rolls in there, Bob.
Yeah, again,
that
Brad
tight.
does this already. He's been doing this with a different device. So he can tolerate a fair amount. And you couldn't tolerate it at the beginning, right, Brad?
Right. Yeah. So I had a towel. I put a towel over the top.
Yeah, you can put a towel over to blunt the edge a little bit.
Yeah.
Because again, if you are new to this is going to be very aggressive for you, and I don't want anybody upset that they try this and they go, what are they? So you could do it against the wall to start off with, or even set it against the wall and just lean up against it.
I'm going on my glute or piriformis muscle, which is commonly a tight spot. But again, I'm maintaining good control through my arms and my feet. So I'm gently putting pressure down and I'm working it. You're not just going to put all your weight in it. It's going to be pretty aggressive.
So I do this type of stretch every day almost.
Yep.
I do my daily stretch program. And I had to go to a funeral lately, not too long ago. And so I didn't do it for 2 days.
Yeah.
And I was just getting all this stress and pain in here. And I'm like, is it just for the funeral or is it because we're driving a lot? Which it probably was too. But I think it was
from the in-laws.
Well, the in-laws didn't help either. But it really was. There was. I like that daily morning stretch.
Sure.
To get me into good position, and I really takes away a lot of those.
It's like eating healthy food, Bob. It's just a maintenance thing you do with your body.
Yeah, you're really into the diet thing now lately.
Well, yeah, it's I got to get another book, as a matter of fact.
Yeah,
I was going to talk to you about that later.
That's good to keep reading up on it. So, all right. Remember, Brad and I can fix just about anything
except for
a broken heart.
But this is pretty close. Yeah, you can work on that. Look at this.
Do some compressions with it.
It almost looks like a heart, doesn't it?
It looks like an egg.
Well, egg, heart, whatever.
Whatever.